Hey everyone, welcome back to the channel. Or if you're new here, I'm so glad you found this video. Today, we're diving into a topic that millions of women around the world are navigating right now: pregnancy after 30. Maybe you're 32 and just starting to try. Maybe you're 38 and already pregnant, wondering what to expect. Or maybe you're in your early 30s and planning ahead. Wherever you are, this video is for you. Now, I want to be upfront. This is an educational video. I'll be sharing medically accurate, evidence-based information, but always talk to your own doctor or midwife about your personal situation. Every pregnancy is different. Here's what we're covering today. The real risks of getting pregnant after 30, not the scary headlines, but what actually matters. The genetic and chromosomal facts you need to know. And most importantly, practical doctor-approved tips to have the healthiest pregnancy possible. Let's get into it. Section 2, the reality of pregnancy after 30. First, some good news and some important context. The average age of first-time mothers has been rising steadily for decades. In many countries, having your first baby in your 30s is now completely normal and incredibly common. You are not unusual. You are not too late. Women in their 30s today are healthier, better informed, and better supported medically than any generation before them. Many doctors will tell you that a healthy 34-year-old is a better candidate for pregnancy than an unhealthy 24-year-old. That said, medicine does use a term called Advanced Maternal age, or AMA, to describe pregnancies in women aged 35 and over. You might also hear the older term geriatric pregnancy, which, honestly, is one of the most misleading terms in all of medicine. You are not geriatric at 35. But the label exists because certain medical risks do start to rise after that age, and your care team wants to monitor you more closely. Here's the key takeaway. Risk rising doesn't mean risk is high. We'll break down the actual numbers, not just scary percentages, so you can make informed decisions. Section 3, key risks of pregnancy after 30. Risk 1, fertility decline. Let's start before pregnancy even begins, with fertility itself. Women are born with all the eggs they'll ever have. As you age, the number of eggs decreases, and importantly, the quality of those eggs also declines. This means it can simply take longer to conceive after 30. In your early 30s, fertility is still quite high. Most women conceive within 6 to 12 months of trying. By 30, fertility starts to decline more noticeably. By 0 or 40, the monthly chance of conception drops to around 5%. This doesn't mean you can't get pregnant. Millions of women do every year in their late 30s and 40s. But it does mean it may take more time, and sometimes medical assistance. What you can do. If you're over 35 and have been trying for 6 months without success, that's when most doctors recommend seeing a fertility specialist, rather than waiting the usual 12 months recommended for younger women. Risk 2, miscarriage. This is a painful topic, but an important one. Miscarriage rates do increase with age. Ages 20-24, approximately 4%. Ages 30-34, approximately 11-12%. Ages 35-39, approximately 20%. Ages 40-44, approximately 30-35%. The primary reason is chromosomal abnormalities in the egg. Older eggs are more likely to have errors during cell division, which can result in a pregnancy that the body doesn't continue. This is devastating when it happens, but it also means most women in their 30s who conceive do carry their pregnancies successfully. Risk 3, gestational diabetes. Gestational diabetes is a type of high blood sugar that develops during pregnancy. It affects about 6-9% of all pregnancies. But the risk increases with age. Why? As we get older, our cells become slightly less responsive to insulin, and pregnancy itself already puts strain on the insulin system. Gestational diabetes can cause a larger than average baby, which can complicate delivery, increased risk of preterm birth, higher likelihood of needing a C-section. The good news: it is very manageable with diet, exercise, and monitoring, and it typically resolves after delivery. Risk 4, preeclampsia and high blood pressure. Preeclampsia is a pregnancy complication involving high blood pressure and signs of damage to other organs, usually the kidneys. It affects about 5 to 8% of pregnancies overall, but the risk is higher after 35. Symptoms to know: severe headaches, vision changes, blurriness, seeing spots, sudden swelling in face or hands, upper abdominal pain. Preeclampsia is serious but treatable, and your prenatal care team will monitor your blood pressure at every visit, specifically because of this. Risk 5. Higher rate of C-section. Women over 35 are statistically more likely to have a cesarean section. This can be due to complications during labor, placenta previa, placenta covering the cervix, fetal distress. A C-section is major surgery with its own recovery process, but it is very commonly performed safely every day. Knowing this risk helps you plan and have conversations with your provider about your birth preferences. Risk 6. Preterm birth. Delivering before 37 weeks is slightly more common in women over 35. Premature babies may face breathing difficulties and other health challenges, but with modern neonatal care, outcomes are overwhelmingly positive even for babies born several weeks early. Section 4. Genetic and chromosomal risks. Now let's talk about one of the most commonly discussed risks: chromosomal abnormalities, particularly Down syndrome. This is often the first thing people mention when you say you're pregnant over 35, and it can feel alarming. So let's look at the actual numbers. Maternal age, risk of Down syndrome, miscarriage, 25, 1 in 1 to 50. Martyr 1 in 952. 35, Sarcher 1 in 385. 38, 1 in 175. 40, 1 in 106. 45, 1 in 30. Yes, the risk increases with age. But notice, at age 38, the risk is still less than 1%. At 40, it's about 1%. These are real risks worth screening for, but they are not certainties. Screening options available to you. 1. Cell-free fetal DNA, cfDNA, NIPT, a simple blood test from around week 10. Non-invasive, very accurate for Down syndrome and other chromosomal conditions. This is now routinely offered to all pregnant women over 35. Day. First trimester combined screening. Ultrasound plus blood markers done at 11-13 weeks. Gives a risk estimate, not a diagnosis. 3. Amniocentesis. A diagnostic test, not just a screen, that gives a definitive answer. Involves a needle into the amniotic sac. Tiny risk of miscarriage, 0.1–0.5%. Typically offered if screening shows elevated risk. 4. Chorionic villus sampling, CVS, similar to amniocentesis, done earlier, 10 to 13 weeks. The decision of whether and which tests to pursue is deeply personal, and your genetic counselor or OB can help you navigate these options based on your values and circumstances. Section 5. Warning signs to watch during pregnancy. Regardless of your age, every pregnant woman should know the warning signs that require immediate medical attention. After 35, your prenatal visits will be more frequent, but you should never wait for your next appointment if you experience. Call your doctor immediately or go to the ER if you have some heavy vaginal bleeding at any stage, severe abdominal or pelvic pain, sudden severe headache unlike any you've had before, vision changes, blurring, flashing lights, temporary vision loss, sudden significant swelling in face, hands, or legs, baby's movement significantly decreased or stopped after viability, zappers, fever over 38 degrees, 100.4 degrees with chills, difficulty breathing, signs of preterm labor before 37 weeks, regular contractions, lower backache, pelvic pressure, fluid leaking. Your care team would always rather get a call that turns out to be nothing than have you wait on something serious. Section 6. Healthy tips before you conceive. Okay, now let's shift to the positive, empowering part of this video. Because while those risks are real, the flip side is also true. What you do before and during pregnancy makes an enormous difference. Let's start with preconception. Before you're even pregnant. Tip 1. Get a preconception checkup. See your doctor before you start trying. This is called a preconception visit, and it's one of the most valuable things you can do. Your doctor will review your overall health and any chronic conditions, thyroid, diabetes, blood pressure. Check your immunizations. Rubella and varicella immunity matter a lot in pregnancy. Review any medications you're taking that might need adjustment. Test for STIs and check cervical cancer screening is up to date. Discuss family history and whether genetic carrier testing is appropriate for you. Tip 2. Start folic acid now. On screen, 400-800 mcg folic acid daily, ideally 3 months before conception. Folic acid is a B vitamin that dramatically reduces the risk of neural tube defects. Serious birth defects of the brain and spine. The neural tube closes in the very first weeks of pregnancy, often before you even know you're pregnant. That's why you need to start before conception. Take 400-800 mcg of folic acid one daily. Most prenatal vitamins contain this amount. Tip 3. Reach a healthy weight. Body weight affects fertility and pregnancy outcomes significantly. Both being underweight and overweight increase risks. Obesity increases the risk of gestational diabetes, preeclampsia, and C-section. Being underweight can disrupt ovulation and increase preterm birth risk. You don't need to be perfect. Even modest improvements, losing 5 to 10% of body weight if overweight, meaningfully improve outcomes. Tip 4. Stop smoking and alcohol. On screen, bold text. No safe level of alcohol in pregnancy has been established. Smoking during pregnancy increases the risk of miscarriage, low birth weight, the preterm birth, stillbirth, sudden infant death syndrome, SIDS. Alcohol passes directly to the baby through the placenta. There is no known safe amount. And fetal alcohol spectrum disorder is entirely preventable. If you struggle to quit, talk to your doctor. There are safe, effective support programs. Tip 5. Review your medications and supplements. Many common medications are not safe in pregnancy, including some that are sold over the counter. Before you start trying, bring a full medication list to your preconception appointment. Discuss any herbal supplements. Many are unstudied or unsafe in pregnancy. Avoid vitamin A supplements, retinol form in high doses, teratogenic in large amounts. Section 7. Nutrition in pregnancy after 30. Nutrition during pregnancy is important at any age, but after 30, there are a few things worth paying extra attention to. The core principle. You don't need to eat for two. What you actually need is roughly 350 extra calories per day in the second trimester and about 450-500 extra calories in the third. Quality matters far more than quantity. Key nutrients to prioritize. Folic acid, folate, neural tube development, already covered. Good sources. Leafy greens, lentils, beans, fortified cereals. Z2. Iron. Blood volume increases by up to 50% in pregnancy. Iron prevents anemia. Good sources. Lean red meat, spinach, lentils, fortified cereals. Pair with vitamin C to boost absorption. Note: iron deficiency anemia is more common in women over 35. Your doctor will test for it. Calcium. Essential for baby's bones and teeth. If you don't get enough, your body takes it from your own bones. Good sources: dairy products, fortified plant milks, tofu, sardines with bones. DHA, omega-3s. Critical for fetal brain and eye development. Good sources: oily fish, salmon, sardines, trout. Algae-based omega-3 supplements. Safe fish: salmon, trout, sardines, cod. Limit high mercury fish like shark, swordfish, tilefish, and limit tuna. Vitamin D. Supports immune function, bone health, and may reduce preeclampsia risk. Many pregnant women are deficient, especially in less sunny climates. Good sources: fatty fish, egg yolks, fortified foods. Most prenatal vitamins contain some D3. 6. Choline. Supports brain development, often missed by prenatal vitamins. Good sources: eggs, especially the yolk, meat, fish, legumes, iodine, thyroid function, and brain development. Good sources: dairy, seafood, iodized salt, foods to avoid in pregnancy. Raw or undercooked meat, poultry or seafood, risk of listeria, salmonella, toxoplasma. Unpasteurized dairy and juices. Deli meats and hot dogs unless heated until steaming. Raw sprouts. High mercury fish, shark, swordfish, king mackerel, tilefish. Unpasteurized soft cheeses, brie, camembert, blue cheese. Raw eggs and foods made with them. Some dressings, homemade mayo, cookie dough. Excessive caffeine, limit to under 200 ml day, roughly 1-2 cups of coffee. Alcohol, none. Prenatal vitamins. Take a prenatal vitamin every day, ideally one that contains 400-800 mg folic acid, 900 iron, 1000 mg calcium, or supplement separately. 600 IU vitamin D and DHA. Some women find prenatal vitamins cause nausea. Try taking them at night with food, or ask your doctor about alternatives. Section 8. Exercise and mental health. Exercise in pregnancy, unless your doctor has told you otherwise. Exercise during pregnancy is safe and strongly encouraged. The goal is 150 minutes of moderate activity per week. Best options for pregnant women: walking, swimming and water aerobics, gentle on joints. Prenatal yoga, great for flexibility and stress. Low-impact aerobics. Stationary cycling. Light strength training. Avoid after the first trimester. Exercises lying flat on your back can compress a major vein. Contact sports or high fall risk activities, skiing, horse riding, gymnastics. High-altitude activities, and scuba diving. Hot yoga or hot tubs, overheating is dangerous. Stop and call your doctor if you experience chest pain, severe breathlessness, dizziness, headache, calf pain, or vaginal bleeding during exercise. Exercise in pregnancy can reduce gestational diabetes risk, reduce excessive weight gain, lower the risk of preeclampsia, 1. Improve mood and sleep. Prepare your body for labor. Mental health in pregnancy. This doesn't get talked about enough. On screen, 1 in 5 women experience anxiety or depression during pregnancy. Pregnancy after 30 often comes with additional emotional weight. Anxiety about risks and test results. Pressure from family or society. Career and financial stress. Previous miscarriage or fertility struggles. Grief, if this is a pregnancy after loss. Please know, anxiety and depression during pregnancy are real, common, and treatable. They are not signs of weakness or bad motherhood. Signs to discuss with your doctor. Persistent sadness, hopelessness, or feeling numb. Constant, overwhelming anxiety that interferes with daily life. Sleep problems not related to physical discomfort. Avoid loss of interest in things you used to enjoy. Intrusive or frightening thoughts. Effective treatments include therapy, especially CBT, support groups, and in some cases, medications that are safe in pregnancy. Practical tools. Prenatal yoga, meditation, journaling, connecting with other pregnant women, and limiting time on social media that makes you compare yourself unfavorably to others. Section 9. Working with your healthcare team. One of your biggest advantages when you're pregnant after 30 is modern medicine, so use it fully. Your prenatal care schedule, over 35. After 35, you'll typically have more frequent prenatal visits and additional monitoring. Weeks 6 to 8. Confirmation of pregnancy, first scan. Weeks 10 to 13. NIPT, cfDNA blood test, first trimester screening, nuchal translucency scan. In weeks 11-14, Sianinis discuss options with genetic counselor if needed. Week 16 to 20, anatomy ultrasound, detailed scan. BART, week 24-28. Gestational diabetes screening, glucose challenge test. Week 28, visits every 2 weeks, versus monthly for younger women. Prenatal week 36 plus, weekly visits. Fetal monitoring may begin. Questions to ask your doctor. What genetic screening tests do you recommend for me? How often will I have ultrasounds? Do I need additional monitoring? NSTs, biophysical profiles. What should I do if I notice reduced fetal movement? Is there anything specific about my health history I should be extra watchful of? What are your thoughts on my birth preferences? What are the signs of preeclampsia I should watch for? Build your support team. Beyond your OB or midwife, consider a certified nurse midwife if you want more holistic care, a genetic counselor if you have risk factors or concerns, a registered dietitian for personalized nutrition guidance, a pelvic floor physiotherapist, incredibly helpful in pregnancy and postpartum, a doula, birth support, a therapist or counselor, mental health support. So, what's the bottom line? Yes, pregnancy after 30 comes with some elevated risks. I've been honest about that today because you deserve real information, not false reassurance. But here's what I also know. Millions of women are having healthy pregnancies in their 30s and 40s. The risks, while real, are manageable, especially when you have good prenatal care, good lifestyle habits, and good information, which you now have. You are not too old. You are not automatically high risk just because of your age. You are a person with a full medical picture, and the best thing you can do is work with a healthcare provider who sees that whole picture. Take your prenatal vitamins, go to your appointments, move your body, eat well, rest. Ask your questions, all of them. And please, be kind to yourself. Pregnancy is hard at any age. You're doing something incredible. If this video was helpful, please like and subscribe. It genuinely helps more people find this content. And drop a comment below. Are you pregnant after 30? What questions do you have? I read everything. I'll see you in the next one. Take care of yourself.